Hi, welcome. I see we have you in for a nighttime cranial nerve exam. Is that correct? Yeah, been having some trouble sleeping. It's understandable. Well, please have a seat. I'm gonna glove up and let me tell you a little bit about this exam. We're gonna be testing your major cranial nerves and assessing your senses of sight, taste, touch, sound, and smell. It's a very easy, relaxing exam. Shouldn't take too long. And we'll see if we can get to the bottom of those sleepless nights, shall we? During this exam, I am going to have to touch you. Is that alright? Alright, good. It's just, we need to be very thorough. And make sure that there's absolutely nothing wrong with you, which I'm sure there's not. I'm sure when you get through this exam, I'm not going to find anything. Send you on your way with a clean bill of health. Probably just a prescription for more sleep. Alright. So, the first thing we're going to do in this exam is I'm just going to examine you. So I just want you to look straight at me. Alright, so I'm just going to look at you visually. Inspect, look to make sure that there's nothing glaringly obviously wrong. Okay, I'm just going to come up here. Just look at your scalp. Just checking. Any bumps and lumps? Good. Good, good, good. I'm going to touch your ears real quick. Does that feel? No pain? Again, good. And I come up here and I'm just going to palpate on your forehead in a couple areas. Let me know if you feel any pain. Good. 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 And up on the temples here. Just gonna press any pain. Good. One more time. Press any pain. Good. Alright, lift up your neck for me a little bit. Just want to check under the jaw. Just looking for any obvious swelling. We'll come back to this later. Just want to make sure there's nothing too crazy there. Good. Alright, so visually everything looks pretty good. We're going to begin this examination with testing your sense of taste. So, in the past 2 weeks or so, have you noticed any loss of sensation or any loss of taste when eating, drinking, anything? Any sensations too extreme hot or cold? Eating a popsicle, drinking a hot coffee or tea? No? Okay. That's good. So this should be very, very simple. So what I'm going to do is I'm going to use this clear flavored liquid and I'm going to ask you to close your eyes. Stick out your tongue. I'm going to place a drop on there and you tell me what it is, okay? Alright. So close those eyes for me. And let's begin. Alright, stick out that tongue and drop. What do you taste? Coffee. Very good. Alright. And keep those eyes closed for me. Next one. Drop. What do you taste? Lemon. Very good. Alright. Last one. Keep those eyes closed. And drop. What do you taste? Coconut. Very good. Very good. You can go ahead and open those eyes. All right. Sense of taste is intact, which is great. I would like to look inside your mouth real quick just to make sure there's nothing going on in there. As I said, we like to be very thorough. And no, I'm not going to be using a traditional tongue depressor. It's a little archaic. No. Now we have a new metal depressor. Doesn't go in as far. And this light's very bright. It lets me see everything. So why don't you go ahead. 1, 2, 3, open up, say ah. And I'm just going to look inside. Push that tongue down. Good. You feel it looks good. Still have your tonsils. Not seeing any tonsil stones or indication of tonsillitis. Good. Alright. You can go ahead and close your mouth now. Everything looks good. Why don't we move on to your sense of smell? So, like sense of taste, I'm going to ask you to close your eyes. I'm going to open up a bottle under your nose. I'd like you to take a smell and let me know what it is. Alright? So keep those eyes closed and take a smell. What do you smell? Mint. Very good. Okay. Alright. Next one. And take a smell. What do you smell? Cinnamon. Very good. Okay. And the last one. Take a smell. Take a smell. What do you smell? Lavender. Very good. Very good. Okay then, my friend. It seems that your sense of taste and smell perfectly intact. Next, I would like to assess your ears, okay? Alright, so first thing we're going to do, visual inspection. I'm going to touch them gently just to make sure that there's nothing outwardly, glaringly, obviously wrong. Then we're going to take a look inside, alright? Alright, so start over here. Just going to look at your ear, just going to palpate very gently along the ear. Let me know if there's any pain, discomfort. Okay, good. Nothing looks wrong over here. The other side. Again, just going to gently palpate, 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 palpate. Any pain? No? Okay, good. Alright, wonderful. So, we're going to take a look inside those ears real quick with my handy dandy otoscope here. It's a little light, as you can see. Just going to gently put it in the ear canal, take a look around, be sure there's no problems. So, let me take a look here. Oh yes, that looks very clean, very nice. A nice pearly white tympanic membrane. No blockages, no obvious damage. Good. Very good. And the other side here. Okay, same thing. Tympanic membrane looks good. No damage, no redness. Looks fairly clean. Looks like you take very good care of your ears. You don't see that often. I like to see it. Alright, my friend. Well, the inside of your ears look immaculate. You look like you take very, very good care of them. So for the next portion of the hearing test, we're going to ask you to close those eyes for me again. And I'm going to make a noise in each ear. And I'd like you to either say left or right, or raise a finger, indicate which side you heard the noise on. Alright? Alright. So close those eyes for me. Let's begin. Good. 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 Great. Wonderful. Now keep those eyes closed, 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 and I'm going to introduce some other sounds. So, good. 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 All right, you can open those eyes for me. Very, very good. Do you want to do one more little exam on your ear? This is more of a sensation test for your ears, but what I'm going to do, I have this little dropper bottle. It's empty. You can hear it sprays out a little puff of air. I want you to close your eyes, and I'm going to puff on each ear, and you tell me which ear you hear it in, okay? So, close those eyes for me. And good. 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 Very good. Good. All right. Go ahead and you can open those eyes. Need a minute? Take a little break. Just take a deep breath. Just breathe in and then out. We're a little over halfway through the exam. You're doing wonderful. Not seeing any problems so far. So you have nothing to worry about, alright? Okay. Next, we're going to move on to assessing your eyes. Alright? So we're going to start very, very easy and very simple. A simple eye chart here. Okay? So I just want you to use both eyes and just follow my finger down the chart. Good. 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 Very good. 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 And all the way down here. Good. Can you recognize this color? Red. Good. How about this color? Green. Good. That letter. That letter. That one. All the way down here. Right there. Good. Well, I can't complain about your eyesight there. Again, this is not an optometry appointment, just assessing your nerves, and I wanted to make sure that you at least had acute vision. Not seeing any issues there, which is great. We still have some more eye tests that we need to do, including a color blindness test. Everybody's favorite. So these are my Ishihara plates. I'm sure you've seen these before. You can see that they are colored dots, different colors, and there's a number hidden in there somewhere that you must find. So, tell me what that number is. Good. About that one. Okay. Good. See if I can trip you up a little bit. This one. Very good. That one right there. Wonderful. We'll do one more. Very good. Very good. See, there's no tricking your eyes. It's not a bad thing. Alright, Well, now that I know your vision's at least accurate, why don't we go ahead and test some of those ocular responses, shall we? So the first one we're going to do is what's called the swinging light test. What I'm going to do is cover one of your eyes and swing the light in and then out, looking for your pupillary reaction. Alright? So just relax and swing it and out. Good. In and out. Very good. In, down. Good. In and out. Good. In and out. Good. Alrighty. Other side. In. Now good. In and out. Very good. I know. It's a little silly. But it does give me the info I need. And so far, those pupils look great. So if you can just look straight at me, straight at my nose here, and just follow this light with your eyes. Straight ahead, just follow the light. Good. Good. Very good. Do the same thing, follow the light, but don't get distracted by my fingers. Good. Good. Close one eye. Follow the light again. Good. 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 Close this eye. Follow the light. Good. 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 Wonderful. No major issues so far. Now I'm going to get a little bit closer to you. We're going to take a look inside your eye. So a little light here. See, not too bright. I'm going to scoot up right close to you. Just going to hold your eye open and take a look inside. Look straight. Good. And look up for me. Good. Down. Good. Left. And right. Good. Wonderful. To the other side now. Just keep that open for me. Good. Look straight. Good. Left. Good. Alright. Good. Up. Good. And down. Wonderful. Well, my friend, so far so good on the eyes. Not seeing any problems. Would like to test your peripheral vision real quick. So, same as before. Look straight at me. And let me know when you can see my fingers come into your vision. So, good. And when they go out, good. And when they come in, good. And when they go out, good. In the other direction, we'll test going out, good. Coming in, good. Going out, good. Coming in, good. Wonderful. Well, my friend, I can't see any big issues with you so far. But we do have one more portion of the exam. And we do like to be thorough with this. And this is testing your sense of sensation. Alright? Alright, my friend. We are now going to begin the final portion of the examination, and that is testing your sense of sensation. So, for this part of the exam, I'm going to ask you to close those eyes again for me. And I'm going to be touching you with different objects. Some may be sharp, some may be dull, some may be hot, some may be cold. And you need to tell me the different sensation that you are feeling and where you feel it. Alright, so this is going to be touching you around your face, in your neck, your ears, nothing in your eyes, I promise, like that. Just close your eyes. we are going to start with a sharp object that will not pierce the skin, I promise, and a dull object. Alright, so keep those eyes closed. And here we go. Touch. Dull, very good. Touch. Sharp. Touch. Sharp again. Touch. Dull, very good. Touch. Dull. Touch. Sharp. Touch. Dull. Touch. Sharp. Very good. Keep those eyes closed for me. And we're going to do the same thing, except this time I need you to differentiate between this touch, which is cold, and this touch, which is warm. Okay? Alright. Keep those eyes closed for me. And touch. Cold, very good. Touch. Warm. Touch. Warm again. Touch. Cold. Touch. Cold. Touch. Warm. Touch. Warm. Good job. Go ahead and open your eyes for me. We are almost done. We passed the sensation portion perfectly. Just want to test those facial muscles real quick and we'll get you on your way, alright? Alright. So, look straight at me. Just gonna come here. Just feel under the jaw. Just looking at those lymph nodes, making sure nothing's swollen. Good. And while I have you here, just go ahead and clench your jaw real tight for me. Good. One more time. Good. Alright. Look straight at me. Go ahead and blow your cheeks out. Yeah, silly, I know. Big frown. Good. Raise your eyebrows. Good. Big smile. Good. See? You end the exam with a smile. But my friend, I have to say, I don't think you see anything wrong with you. So you don't have anything to worry about. You don't have to stress. I will write you a recommendation for a sleep clinic since you are having issues falling asleep, and hopefully they will be able to assist you. But otherwise, rest assured, you're perfectly fine, perfectly healthy. But we will make sure that you get to sleep. So go home, drink some water, get a good night's sleep, and we'll see you soon, okay? Alright. Bye-bye.